Hello, my name is Joel Straz, Health Officer with the Bay County Health Department. Today is Tuesday, February 2nd, and this is our weekly COVID-19 update and COVID-19 vaccine update. Well, the good news is that the virus levels have dropped considerably since November and December, almost in half to what they were, and even further. Our test positivity rate is now below 5%, and that's a good thing. We haven't been that low since the beginning of October. We still have a ways to go, but we are moving in a positive direction. We do have some concerns about some of the variants that are showing up here in Michigan and the United States and throughout the world, and we'll talk more about those in a few minutes. But in the meantime, we all need to do our part. We all need to wear a mask, to watch our distance, and to wash our hands and use good hygiene. In addition to that, as vaccine becomes more available, we all need to get vaccinated. And that's part of the reason too why we're engaging with you on a weekly basis. Well, we're starting to see slight increments in the supply of vaccine, and that's a good thing. And we're cautiously optimistic that more vaccine supply will become available in the coming weeks. We hope to see that by March we have a full roster of vaccines to provide and that all of our vaccine demands can be met. But we're still dealing with really bad supply problems right now. Okay, so let's talk about the variants, and you've probably heard a lot about this in the news, and they're causing a lot of concern, but what do we actually know about the variants? First, there are three different types of variants that we're concerned about. The first one is the UK variant, or B.1.1.7. The second is the South African variant, B.1.351, and the third is South American variant, or E.484K. Now, the thing that is known about these variants are they seem to be more transmissible and more efficient at transmitting than the old variants. It's important to note, however, that the virus is constantly mutating, and there are thousands of types of variants that have sprung up since the beginning of the pandemic last year. While we do know that these variants are more transmissible, there's still a lot to be learned about whether or not that the vaccines are effective against them. And it seems at this point in time, at least for the UK variant, that most of the vaccines are effective at combating that particular type of variant. But there's more study that has to be completed. Well, we are constantly trying to make improvements and to make the scheduling and registration system more effective and more responsive to our residents' needs. We're doing that particularly by trying to identify those most at risk, especially people over the age of 65, and Tier 1A and Tier 1B workers, especially first responders and teachers. We're working with employment groups in some of those and employers so that we can effectively vaccinate those particular employees. In the coming weeks, we hope to employ a system where identified individuals can choose a vaccination date and time and site at their own needs electronically. There's more to come, so please be patient. Well, we've talked before about keeping a watchful eye on your phone and your email so that you can effectively respond to our schedulers and vaccine registrars to make an appointment. To help this process along, there are a few essential data items that you can provide. The first being your complete name, address, and a working telephone number. Second would be a working email account that you've got access to. Third would be having access to your insurance information, including your group number and serial number. And most importantly, if you're age 65 or older, your spouse's information as well. This last item is important, especially for couples over the age of 65. We here at the Bay County Health Department are trying to schedule spouses and eligible family members at the same time as much as we possibly can. The representative from the health department should ask you in regards to your spouse's vaccination status, if it's applicable. If they do not, please inquire and ask them so that we can attempt to provide your spouse with the vaccine at the same time possible. Now, this is not always done, but we're going to try to make this more the norm than the exception. There are some simple things that you can do. First, inquire at the time of your first vaccine appointment and note that on your vaccine card when you are due for a second dose. If you did not receive a card, ask for one at the vaccine clinic and our representatives will be more than happy to grant you one. The second is check your phone and your email on a regular basis, especially on those days leading up to the second vaccination appointment. Sometimes vaccine supply lines can be interrupted or delayed, and there may be delays. We're working closely with the state of Michigan to rectify these types of situations, but always check your phone and your email. So you may have received an appointment reminder from another provider in the community, and they have offered you an appointment before the Bay County Health Department has contacted you. By all means, take that appointment, make that appointment, and get vaccinated. You need to be registered and you need to have an appointment. You cannot just show up for a vaccine. Actually, no, it's not allowable. We need you to keep your appointment, date, and time. If you need to cancel your appointment, then contact the health department through the number that your representatives have provided you to cancel your appointment. And then in turn, we will provide the vaccine to someone that's on our on-call list. However, we can't make last-minute substitutions without having a person registered. The short answer is that there are two vaccines that are currently available today. There's the Pfizer-BioNTech vaccine and the Moderna vaccine. They are both mRNA vaccines, and they are virtually effective, the same rate. So not one vaccine is better than the other. As far as substituting vaccines go, remember, once you're on a vaccine track with one specific vaccine, you have to finish that track. So if you start with a Pfizer vaccine, you've got to finish with the Pfizer vaccine. If you start with the Moderna vaccine, you've got to finish with that vaccine. You can't mix and match or switch. So with vaccines being in short supply right now, we're constantly looking at our registration list to make sure that the right vaccine gets to the right people at the right time. And part of that is to look at those groups and those persons that are most vulnerable, especially people over the age of 75 and people 65 and older, which is a considerable part of the Bay County population. 1 in 4 residents in Bay County are over the age of 60, so this is a huge number in comparison to other counties, and we have just a limited supply of vaccine. We're looking at the registration list on a daily basis to ensure that these seniors and these folks that are most in need of vaccine get those vaccines. And we might not be as responsive as everyone would like us to be, but please note that we just have a limited supply of vaccines at this point in time. So we're doing our best to get everyone vaccinated as quickly as possible. So that wraps it up for Tuesday, February 2nd. Please keep an eye on the Bay County Health Department's website and our Facebook page and this particular YouTube channel. Thank you again and see you next week.